Everyone knows that if there is cancer in any part of the body, it has to be removed by surgery. But she wanted to be a mother with a cancer in the uterus. Then after treatment, she gave birth to children. She is now alive with a healthy body. She is a real hero by all means. Those who fight cancer with tooth and nail, today is their story. I don't know who is your hero or heroine, but as I have to deal with complex gynecology and gynecological cancer treatment, my heroes are quite different. Look at her. You may think that this is a couple from an ordinary Bengali family with 2 children. She is a hero. Maybe she will become your hero too if you listen to the whole saga. She was diagnosed with cancer in the uterus in her 20s. They were married by then but yet to have a baby. Despite enduring months of treatment and undergoing multiple surgeries, she never lost her determination and eventually became the mother of 2 children from her cancer-affected uterus. Then, today, after the treatment, she is cancer-free. How can young women who have had uterine cancer still become mothers? I will take you to our operation theatre shortly. How are they treated? No magic, no tricks, tough, cutting-edge science, the indomitable spirit of patients and the tireless efforts of our team. Trend of uterine cancer is changing. It used to occur in older women. Nowadays, it is affecting younger women too. When they are still so young, not even 25 or 30, many have not even achieved motherhood yet. It's a whole different story. Why uterine cancer is happening at such young ages? Keep it for another day. At this age, many couples visit gynecologists for having children. She did too. The pattern of bleeding and a biopsy from inner lining of the uterus revealed that she has uterine cancer. Treatment of uterine cancer requires removal of the uterus, so many young patients comes to us being demoralized with a strong hope of motherhood. They spend hours and hours of discussion in the clinic to give shape to the dream of motherhood in their eyes. We start finding up-to-date research. If they choose the right treatment, they will not die of cancer and still will keep the uterus and to have a child. This kind of study goes on for several days. In this, the patient and the family members become informed of new research on options of fertility preserving treatment of uterine cancer, its results, the good and bad. By this time, they know this therapy inside out. They could even give a talk on the spot on this matter. And yes, this treatment does not work by just daydreaming or fantasizing the success. The patient needs the grit and the indomitable will to achieve the goal. At this time, my job entails overseeing and organizing a team comprising of dozens of members. The dietitian will tell the patient what she will eat. The patient will report to her every week. Physiotherapists and fitness experts will tell her how much walking and exercise to do. Nurses call the patients every 3 to 4 days in the beginning. How is the progress? She is told everything, even where to get the chicken from and if you should eat soybeans. Monday morning breakfast menu and preparation starts from Friday. We teach patient's husband, father-in-law, mother-in-law. Once we had to call housemaid and take her class in our clinic even. Multiple biopsies are done during this time. Review biopsy is needed after the first biopsy. It is sent to senior pathologists in Kolkata for review. Times have changed now. Not all pathologists perform all types of biopsies. Doing what is right for the patient is of our utmost priority, not convenience. The biopsy is not submitted wherever convenient, but to the right person who has the immense enthusiasm and continued study on this matter. The pathologist attentively listens to the patient and closely re-examines the biopsy under the microscope. This is followed by a CT scan and MRI scan. The MRI scan is especially important. The radiologist who performs the MRI scan talks to the patient and the husband. We discuss again and again. Every millimeter of inside the uterus is our concern because her cancer started from this lining inside the uterus. Then she will be admitted for hysteroscopy, which means to look inside the uterus with a camera. Caution is necessary during hospital admission. Any expecting mothers near our patient aspiring to be a mother cannot share room with a new mom. Our patient's feelings may get hard. We must also prioritize our mental well-being. The bed manager is informed about the request in advance. Patient does not need to know about all this planning. Hysteroscopy starts now. We have another video on how hysteroscopy is done. If you want to know more about hysteroscopy, you should watch that. The whitish lining, that is the fluttering light feather at 12 o'clock, is the endometrium, the inside lining of the uterus. This thing is moving as the jet of the saline water going through the hysteroscope. Red patch means fresh bleeding from those areas. Now, by moving the camera, we are looking at the opening of the fallopian tube on the left side, medically called cornu. That's left side of the patient. In the future, when the egg comes out from our ovary, the egg will enter the uterus through that cornu itself. Now, let's look at the opening of the fallopian tube on the opposite side, that means the right side. It is though hidden behind the tumor. With gentle movements of the camera and the hysteroscope, I could reach the right corner. The irregular area is cancer tissue. We have to be hyper vigilant and avoid too much movement. Some more biopsies will be taken from this cancerous part. Although this is not the goal, an attempt will be made to remove as many cancer tissues as possible. Now, a delicate loop-like thing is inserted through that 5mm hysteroscope. Modern medical electricity is passing through it so that even if the cancer is removed, the bleeding is not excessive. My 3 fingers are moving the instrument most delicately. Slowly, these suspicious tissues are being removed. If the cut is too deep, then it may damage the underlying uterine wall. Future pregnancies will take its food from this wall itself. Even a slight extra movement of millimeter extra movement can cause severe damage. These tissues are taken and sent for biopsy again. The veteran pathologist will sit again with new biopsy. Sophisticated pathology, genetic molecular markers are assessed as necessary, and the patient is then placed on therapy so that the cancer of the inside lining of the uterus can be reversed. There are dangers too. During treatment, the patient's body weight, liver function, vision and heart should also be monitored. After a few months of therapy, we assess the situation with the camera. When things turn out satisfactorily, we speak to her infertility specialist. Meeting occurs in phases. All types of infertility treatment will not be suitable for her. Certain treatments can even increase the chance of uterine cancer coming back. At last comes the coveted time when her quest for motherhood is fulfilled. Is this path completely smooth and beautiful? And is everything so seamless? Not at all. There are risks, side effects, and strict monitoring at every turn is needed. We need an indomitable mentality of the patient. When the baby is 3 to 4 months old and nearly done breastfeeding, a surgery is done to remove the uterus and address other issues. The journey is long, spanning over a couple of years, requires infinite endurance and constant communication with the patient. When I returned from England, I could not even imagine that such high quality treatment could be done in India. Not just technology, not the wishes and knowledge of the doctor. It requires modern social awareness and still hard grit and indomitable mental stamina of my heroes and their families. Fertility preserving treatment is now available for many gynecological cancers, including cervical cancer, ovarian cancer, and not just the uterine cancer. That's all for today. If you want to chat with my hero someday, just comment below and we will do our best to arrange a meeting and conversation with my hero and their family. Have a good day.